All right, good evening, everybody. Dr. Jared here. We have a very special presentation for you tonight. I'm both blessed and proud to be here with Cheryl New from True Health Medical. So as you guys know, tonight is about regenerative stem cell therapy. And a couple things about stem cells. Regenerative therapy, the reason we're even talking to you about this tonight is, in my opinion, this is something that I would personally rather do long before I had surgery if I was a candidate for it. It follows my personal, and I know many of your philosophies of helping to allow your body to heal itself by getting to the root cause of the problem. Additionally, anytime you're talking about natural therapies, just like you shouldn't go to just any random chiropractor and consider them all the same. Not all regenerative medicine companies are the same. In fact, what I love about True Health is their clinical excellence as far as the experience of their team members. They have the ability of seeing the process all the way from the start in their lab, all the way to the completion with the treatment itself. And they have people with just massive amounts of experience. So, as we go through this tonight, feel free to post comments, post questions. You can also privately message or email me if you'd like, but we will be responding to questions as this completes. Additionally, though, if you're sitting there and you find that you feel you are a candidate for this type of therapy, I want to just go ahead right away and go over the way that this happens. So if you find you're a candidate for therapy, the total fee is either $50 if you want 1 or 2 joints looked at, or $100 if you'd like 3 or more. And that covers the cost of the x-rays, the collaboration with myself and Cheryl, and going through the consult on what would be recommended as far as the treatment itself. So with that being said, I want to introduce you guys to Cheryl New. She's the Chief Integration Officer at True Health Medical, and she's going to tell you just a little more about herself.
Hi, everybody. Thanks for tuning in. As Dr. Jared said, I'm Cheryl New. Chief Clinician Officer. I work a lot with the NPs and PAs that are involved with True Health, and we are very excited to partner with Dr. Jared's clinic to bring regenerative medicine there. A little bit about my background. I started about 22 years ago with a master's degree in molecular biology. I did a number of years of research in gene therapy protocols. Those protocols we were able to see through to clinical trials, and I am a published author on a lot of those research experiments that we did. I enjoyed the clinical aspect so much, wanted to be part of patient care, that I went back to a medical program and am now a board-certified physician assistant. I've been practicing medically for almost 20 years, and I have experience in emergency medicine, orthopedic medicine, plastic surgery, and regenerative medicine. So that's a little bit about me. We, again, enjoy bringing regenerative therapy. I've had experience with regenerative therapy myself, as well as I have treated a number of patients and had some just amazing results. So I would encourage anyone that has an interest in that to sign up for a consultation.
All right, so let's go ahead and get started. Here's just a little bit about the team. For any of you that are watching here, you can see just huge amounts of experience, all the way from Dr. Gonzalez, who I believe, Cheryl, you said has been working with stem cells, is it right, for over 20 years?
Correct. Very early pioneer of stem cell research.
Is there anything else you want to say about the team, or should we really just jump right into it here?
Well, just again, we have a lot of medical experience and medical background, and these are MDs. I mean, we are people that have practiced clinically. We believe in traditional medicine, but we also value what regenerative medicine has brought to the table. And it's a little newer, a number of years background, but as you see as the presentation goes on, there's so much research that is being done in different aspects than even what we're referring to with stem cells. So we're excited to talk about that.
So as far as this goes here, I mentioned this in the opening, but what it does is it allows your body to help heal itself. So what if you have a bad knee from an old injury or an old tendonitis or, small labrum tear or something in your body, and, your body just doesn't have the capacity, it seems, to get it all the way corrected to the point where you either have functionality or pain relief from it. This stem cells or regenerative medicine can help your body heal itself so that you improve the functionality, ideally for the long term. A little bit more about the field. It just talks about getting to harnessing the body's ability to heal damaged tissues through fixing structure and function. And now Cheryl's going to tell you a little bit more about what stem cells really are.
So basically, to not be overly complicated, stem cells are an undifferentiated cell, which means they are the cell population, and there's different types of stem cells that help us to regenerate our body. So we are constantly healing and repairing. We're creating, new skin, we're creating new stomach lining, and these are the powerful cells that give us that ability to regenerate as we age. You can go on. In our next slide, we like to talk about the specific type of cell population that we look at in the orthopedic realm. We're concentrating mostly with mesenchymal stem cells. So these are stem cells that are in the lineage of reproducing, repairing things like muscle, cartilage, bone. That's where we're talking about the orthopedic realm. They reduce inflammation. They respond to what's going on in the body. Some of you may hear about stem cells that are coming from yourself, and these are autologous stem cells, and that is absolutely true. You can harvest stem cells, your own stem cells, from your bone marrow or from fat. And this is actually a procedure that I went through when I was doing research in my early years as a scientist. And this is exactly what happened. They put a large bore needle into my iliac crest and took out bone marrow. It is a procedure that can cause certainly pain. It can cause downtime. It can be invasive with risk of infection, and it's expensive. But some of the main points are the potency and variability of the cells at the age that you are looking at doing this. And we're going to talk about a slide in just a second here that kind of defines that a little bit. Okay, on. So this is a slide that I know Dr. Jared likes to talk about, but this is going to show a little bit about how the younger populations, how they tend to heal and repair much better than when you get older. So it is something that when you're younger, you have a lot more stem cells than you do when you age. Go ahead, Dr. Jared.
So I think this is really important to realize. So why would stem cells be so valuable for you? Or if this is your first time hearing about them, I think it's important to realize you've heard about these before. If anybody who's been through a intensive treatment that kills bone marrow, such as like chemotherapy, and they had a bone marrow transplant, the reason they're doing the bone marrow transplant is ultimately to help your body heal and repair. But if you know anything about bone marrow transplants, they can be very painful. They have recovery time, like Cheryl said. Depending on your age, you're going to have less stem cells per area removed. So in this slide, it talks about when you're a newborn, for every 10,000 cells you have one stem cell. By the time you're 50, you have 1 in 400,000, and by the time you're 80, you have 1 in 2 million. So if you were going to try and extract stem cells from your own body, the older you are, the less amount there would be from the extraction. And so ultimately, you want to get back to the source of, if they're undifferentiated, that means that they haven't turned into what they're going to turn into yet. That's how they can turn into bone. That's how they can turn into muscle. That's how they can turn into cartilage. And so mesenchymal means that they're at true health, they're going back to the beginning, to the blood of and I think you're going to go through this, Cheryl, so I'm sorry I'm bumping ahead, but the blood from a healthy C-section, and what it's doing is that it's extracting a much higher percentage of stem cells, which, because they're undifferentiated, can then turn into whatever your body needs them to turn into.
Yeah, so basically what he's referring to is the source that we believe is the best source for you is from cord blood. So these are coming from healthy C-section planned births. So they are mothers that have consented to basically give what would normally be the birth product that is normally thrown into the trash for us to be able to gather that and screen it and use that product. Now, these are not the red blood cells. You don't have to be HLA matched to these. They don't have adverse reactions, allergic reactions. And again, we are capturing what is considered, when the baby is born, they are considered adult stem cells, but they are in a very early undifferentiated phase. And that's what we refer to with how they have the capacity to regenerate. So basically, you can go on, Dr. Jared. A simplistic model is the baby, again, is a normal, healthy birth, C-section. They are there to gather the product. It is screened and tested. These are FDA-approved labs, American Association of Tissue Banks, that collect the product. And then it goes through a process of cryopreservation or freezing it down. Okay, you can go on. So obviously a very big question is, are they safe? And basically I will often compare to, if you have an accident or injury, you don't go to the hospital, and if they tell you you need blood, you don't say, well, wait a minute, is this a safe product? You anticipate that blood has gone through multiple screenings. And this is many of the tests that they will go through and screen for. And in addition, they do additional testing for fungus, for endotoxins that are not listed on here to make sure that every lot is safe.
And Cheryl, if you would, could you comment, because this was one of the big things when we were first interviewing you guys with True Health, about just how above and beyond you guys go, and as far as making sure that's the best quality and safest product. Could you compare that at all to to some of the, let's say, less ideal companies out there?
Sure. So there are, again, standards of testing with 14 tests that need to be run. I'm sorry, the number of tests that need to be run. And ours goes on to do additional 14 different tests, as well as screening, like I said, for different types of bacteria, fungus, endotoxins. So they will test different lots on different periodic basis to make sure there's the sterility and the safety of the product. Basically, to also understand, this is not just a straight stem cell product. There are stem cells in the product, but there are so many other important signals that also come in this sample or of this product. It's basically, you're looking at a signaling system. So when your body is injured and it sends out a signal that it needs healing, that's also part of what is in here. You're looking at cytokines and growth factors. Hyaluronic acid is the cushioning in a joint. So these stem cells actually produce hyaluronic acid, which gives people a little more cushioning into that joint space. There's proteins, there's different electrolytes. So this is a very powerful product that includes other things besides just the mesenchymal stem cells.
And I will say, when I first started researching this about 3 years ago, this was one of the biggest things that was explained to me, is to look for a company that's not just putting a stem cell in, but really helping your body to utilize. Because what really, and Cheryl, feel free to correct me if I misstate any of this, but what you're trying to do is get these cells to multiply as much as possible so that they have the best overall outcome. And if you think about, planting anything, if you planted flowers this year, you're often going to try and have the best soil, the right conditions for that type of flower to grow. Most people are going to fertilize it. If it was dry, you might water it. You're going to do things that really get the success rate up. And I can tell you why I first started doing this. I started doing this or looking into this for two reasons. Number one, about 3 years ago, my wife dislocated her shoulder and tore her labrum. And so she couldn't hold her arm in the socket. And before we did anything surgically, the first thing we looked at was the labrum tear small enough that we could repair it with stem cells? The second thing that happened is my grandmother, who's been under chiropractic care for 40 plus years. She was at the point where she had been recommended to have a knee replacement in her one knee. She had the other knee that was likely going to need a knee replacement. And additionally, she had MRIs on both shoulders, and there was enough muscle wasting in her shoulders that they told her that basically there was nothing that could be done medically for her. And she got to the point where she almost couldn't put her hand behind her head. Like, it really was hard to do this. And so that's when we thought, well, I don't want to just randomly find a company or randomly hire someone. We want to get someone that we consider to be the best, because we're going to put it in my family specifically. And so the exact same stuff that we're talking about here, when you talk about these things, these are the things that we've used now in my grandmother and many other people, but it's why it took us so long to really even be able to deliver a product like this. So anything else to add there, Cheryl, or should I just keep going?
Well, I certainly can add in, personal story too. I've had stem cells myself. Again, one of the orthopedic doctors I worked with was an upper extremity surgeon, and I saw many people that went through what's called basilar thumb arthritis. So it's, struggling to grip. You lose your grip strength over time, and it just hurts. The base of your thumb hurts. And I would say I'm fairly young to already start to see that, but I've been injecting for 20 years. And so it's typical when you're constantly using that thumb joint to get pain down there. So realizing that was coming on, I felt like I was a prime candidate for trying stem cells myself. And I did that. I had a colleague that injected the base of my thumb, and was able to personally see significant improvement with the pain I was feeling in that joint, as well as obviously the number of people that I've treated to be able to see significant improvement, different levels of improvement, which is something we can talk about, and just a change of quality of life overall for a lot of patients.
Absolutely. So when we talk about treatment, I mentioned a little bit of this earlier, but some of the things that happen is when your body's able to heal, it really reduces inflammation. And inflammation is a huge component in pain when people have pain in joints. Cheryl talked about lack of cushioning. That's where she was talking about hyaluronic acid. But so some of the things that happen when you have this treatment is you have the potential for anti-inflammatory activity, which also can stimulate regeneration. They're more potent, like we talked about. The nice thing too is there's very, very few contraindications to being treated. So for instance, I know one of the things that I like about True Health, it goes back to, it's not like everybody just gets treated if they can pay for it or something like that. You really want to figure out, are you a true candidate for this to increase the likelihood of your success rate? But the only major thing that they do not recommend is if the person has had cancer within 5 years. And Cheryl, could you maybe just talk, because I know that's more of just a proactive approach, right?
It is. Cancer, we know, obviously can occur in different parts of our body and can be an abnormal growth of different cell types. So certainly.
Okay. Did you stop there, Cheryl, or did you go silent?
Can you hear me?
Yeah,
can you hear me?
I can. You froze for a second there.
Sorry about that. So basically, with cancer being an abnormal growth of cells, we want to avoid that. We want to make sure that somebody is cleared not only from cancer, but also from other medical conditions that we would talk about when we review your medical history, to make sure, again, that you're the appropriate candidate.
Yes. So moving on, these can be done multiple times if you needed. One of the things that was explained to me is really the better shape the joint is, that it increases the likelihood of these being able to stick and last for a very long period of time. One of my best friends, now about 2 years ago, received treatment from Cheryl, actually, and he'd had 3 knee surgeries, and yet at age 33 he already was having significant pain being able to to run a mile, and so and now at this point, I know he's climbed the equivalent of Mount Everest. He's training for a 50-mile race. You look at that and go, okay, so this really can repair in a younger person. But what a lot of people do is, unfortunately, they wait till they're almost like at the point of thinking that they need a knee replacement. Well, when you have that much increase in arthritis and that sort of stuff, there is the possibility of needing multiple occurrences over time as you continue to wear and tear on that knee. The last thing it says is that, it's cord blood is bank tested and ready for treatment. And that Cheryl already handled that pretty significantly. So what I'll tell you, conditions that can be treated right now are basically outside of the spine. So although I have one friend in New York that had injections in his spine from herniated disc and has done just absolutely fantastic. But for right now, if you're looking to treat with us, the main things, the top two things are knees and shoulders. However, we have seen people that have had elbows, hands, and feet. So like we've had people do arthritis or damage in their joints, like their thumb, or tendonitis in their elbows. But the top two things that we see are knees and shoulders. I just want to be very open and transparent about that. Over time, there is more potential for hips and back, but at this moment, that's not something that we're able to do currently. She talked about research. So it's like, I think sometimes people fall into I'm going to say a trap of thinking that this is only for, pain in joints. And as you can probably see here, there's, I believe, 5,300 plus research studies that have gone on or are going on related to stem cell therapy with all sorts of treatments. We have a client who was contacted by the Mayo Clinic about a test that they're potentially starting with stem cells. And you see, if it can heal a damaged joint, what could it do for some of these, autoimmune conditions or things like that? And while that research is all being conducted right now, we are focused on joints. But I do want to mention, when I first started having children, I remember being in the OB's office, and there was a pamphlet, and in fact we ended up purchasing it for my oldest child. So it was when we had our first son. They wanted to know, did we want to collect the cord blood and save the stem cells for potential treatment later in life? So if my children were ever diagnosed with some weird genetic disease, he said, we have so much research going on right now that although they should be able to use other stem cells, if you want to have your child's own stem cells or your family's own stem cells to utilize, we have the ability where if you pay us now, we can save these for the next 25 years. And by age 25, your son should have expressed most genetic conditions. So we did that. So again, it's not this fully holistic thing. It is something that's going on in the medical world as well. And if you're wondering, why hasn't my doctor told me about it then, or why did I get injected with cortisone and they didn't give me this option, or why did I have my knee replaced or something like that, and nobody even told me about this? We are going to talk about that in just a moment, but just know this is way, way bigger than just like knee and shoulder pain injections or something like that. All right, so here's some of the frequently asked questions. And again, if we don't answer your question in this, feel free to post it on the message board or private message me or email me. Happy to answer any questions that you have. But I wanted to handle the first one, and Cheryl and I are going to go back and forth a little bit here. But it says, number 3, what is the downtime? And we get that question a lot, and that alone for me is one reason that I think a lot of people should consider doing regenerative medicine. The downtime is way, way different than if you have surgery. So for instance, every person that we've had so far has been able to walk out and drive themselves home. So it's an injection. You're not getting cut open. And for that reason, your downtime is much lower. You're able to walk around and be active right away for most people. Now, if you, for instance, are like a long distance runner, or you like to do Olympic lifts, or you like to play basketball, you may have recommendations from Cheryl or from the person that's doing the process about you may need to hold off for 4 weeks or 8 weeks or something to give them a chance to heal, but the actual downtime is very, very low by comparison to any surgery. And when you start thinking about like a joint replacement, I mean, most people that we have that get, for instance, a knee replacement, they're not able to drive for, a month. They're often not getting full range of motion back for, 2, 3, 4, 5 months. And, it may take 6 months or more to recover. I have one guy that they said, you're going to have to wait 18 months to get full range of motion back in your knee. And some people's never do come back. So that alone is one reason why I always say, start super, super conservative. Like if you can treat it with chiropractic or physical therapy or something, I mean, I personally feel you should start there. Wouldn't be the first stop, but before I would ever do cortisone and before I would ever do surgery, to me, stem cells comes into that arena right there.
So I'll jump in a little bit. So keep in mind also that cortisone is going to be just a temporary fix. It's something that's trying to decrease inflammation in the joint. And certainly some people get relief out of that. But in theory, really, you shouldn't have too many cortisone injections because that can be damaging. It could weaken the anatomy of what is going on in the joint, the ligaments, things like that. So most doctors are going to tell you a similar type of a concept. This is something that is not going to heal that joint. It may allow some decrease in inflammation, which may eventually help the joint, but everybody comes with different levels of conditions. And this will go into a couple of these frequently asked questions. How many treatments will I need? We go into this with the mindset that we're hopeful and prayerful that one treatment is all that you're going to need. But everybody, as I alluded to, comes with different levels of degeneration. You may have had a trauma or an injury, or this may be just arthritis. But certainly every condition is unique. We also have to look at you as an individual. Which we like to know what kind of work you do, what kind of physical activity are you involved with, because all of that is an important part of your healing process. So that's where we have some instructions, we have some guidance to give you on whether or not we can get you back to a certain activity, an activity of daily living that you like to do, or whether or not we need to give it a little bit of time for this joint to heal. One of the correlations I will refer to, which I think is a decent analogy for people to relate to, is think of your joint as if we're coming in and planting grass seed. And we are encouraging those grass seed, those little seedlings to grow and to basically heal and regenerate. And we don't want you running out and playing a football game on this new grass seed that we have just planted. We need to give this time, again, to have its regeneration abilities to heal that joint. So we're going to guide you and get you back. But as Dr. Jared said, if you were going to have a surgery, you would be down and out a lot longer than you would be with a stem cell injection. So certainly we'll get you back to speed. We'll get you back to activity. The longevity of a single injection, some people can get some benefit immediately. We do say to give it a number of weeks to help this healing process. And usually once you're about 4 to 6 months out is where you're going to see the benefit from this injection. Now, again, keep in mind, this is something that you can have different levels of regeneration happen. You may come back and tell me, and I've had somebody say, I feel about 20% better, but that 20% has changed my life. And if I can give you some improvement in your quality of life, you can sleep through the night, you can walk a little further than you walked before, you can go up and down stairs without getting significant pain or hearing a click. Things like that can significantly change, again, your quality of life and the way you get around. So you want to add to that, Dr. Jared?
Right. Well, that kind of goes into the questions 4 and 5, like how long does it last and how fast will I see results? Right in the literature that I believe you had handed me to read about, it talks about, they can continue to grow inside the body for 3 to 6 months. So, I personally have seen people as early as 4 days notice a significant improvement that they've subjectively told me. I think we fall into that, I'm going to say, American mindset of like, it's supposed to fix it right now. for most joints, unless it's a traumatic injury, it took years, if not decades, to be at that point. And so you have to give your body a chance to heal. What this is doing is essentially allowing your body to heal more than it otherwise could have, and allow it to heal faster than it otherwise could have. So how fast? I've seen people do it as early as 4 days. I've seen people get their biggest improvements, 3 to 6 months later. And then how long does it last? Well, it typically depends on you. It depends on how hard you are on that joint. How early do you do it? One of my favorite clients, came in and that did the round last time, Cheryl. If you remember, he said, like, I don't have severe knee pain every day, but I have knee pain whenever I run. So I want to take care of this now and not wait till they're so arthritic and I'm praying that they can be healed, where some other people wait till they can't move or they're worried about being able to continue to work. It's still, we've seen great results with it, but how much is it going to change? It's going to depend on how much damage is in there.
Absolutely. I would agree with that. We have treated people at all different levels, and even some very severe osteoarthritis. We've got some nice improvements, some nice testimonials from that. You just have to look at whether it's right for your lifestyle. Consider weighing your options and just seeing if we can guide you through that process. And that's why we encourage an exam. We encourage a consultation and see if it's right for you.
Cheryl, could you handle the is regenerative stem cell therapy safe, number one?
Sure. So in the presentation, we talked about the safety protocols that we go through. Again, this is a volunteer donation, basically, that is then gone on, collected. No babies are hurt in this process. It's screened, tested through different labs. And certainly, again, we want to make sure it's a very, very safe product before it's used.
And then will you do number 7, and then I'll talk about number 8?
The doctor recommendation, you're going to come to all different levels of training when you go see an orthopedic doctor or your primary care doctor. And there are certainly a lot of doctors that are becoming more aware of stem cell therapy. It's basically been out there, but not real refined. And there's been a number of years where, again, doctors just didn't know because the research wasn't there. And that's continuing to advance all the time, the different levels of research that are out there. But in essence, if you think about how a doctor may make money, especially a surgeon, it comes from performing surgery. So your doctor may or may not be on board with the thought that, hey, if I avoid a surgery by getting a stem cell transplant, that takes away from my business. So we are in the medical community ourselves. I certainly appreciate what doctors are doing and how they evaluate the process. But that's where, as a patient, you have to be well informed of your options. You may eventually need a joint replacement, but there are a lot of people that either don't want that or are not ready for that. And this is certainly a wonderful option to look at.
Right. And if I can add to that, I mean, I've talked to multiple MDs that just absolutely love stem cell therapy. I know some that have done it. I know some in this area that do it. And at the same time, I know plenty that almost ignore it. In fact, and this kind of goes back to, I always like to address this, and this might not be the perfect spot, but I want, when you talk about, for instance, like people when they get cortisone injected into these same joints. Well, cortisone, because it's a steroid, causes or increases the brittleness in the joint potentially. It can cause soft tissue damage. There was just a study done last year that showed that it can actually, there's a percentage chance of causing what they called in the article spiraling arthritis, meaning that you ended up having a joint replacement faster because of having the drug injected. And I consistently, when somebody says they have a bad reaction or they've been doing steroid injections from their pain management doctor or their primary or whoever, and they say, well, why didn't they tell me this was going to speed up my need for a surgery? And I say, I wish they did, because of course you might not have had the 2nd, 3rd, 4th, and 10th steroid injection. Similarly with something like ibuprofen, people often take NSAIDs or pain pills thinking that there's really minimal harm, and yet NSAIDs were ranked incredibly high on the adverse reaction or the side effect rate. They can do everything from raise your blood pressure to they actually are proven through research to slow the healing of the joint itself. And it's like, well, why didn't anybody tell me that as I took 4 of those a day, or 6 or 8 or 10 or 12? And it's like, well, that's what I like about natural therapies, is the risk is so much lower and the upside, in my opinion, is much, much higher. So why did my doctor recommend this? It sometimes falls into the, why didn't they tell you about the risks of what you're already taking or what you're already doing for it? It's a different philosophy, or possibly an administrative approach where they're really not even allowing them to have that option. All right, so I could probably go on for another hour about all those thoughts. So Cheryl, I think, would advise me to just move forward here. So, so what do I do to see if this therapy is right for me? So, right now, if you are in pain, if you're having discomfort, we are able to assess you immediately, essentially. So what you can do is, if you're coming in for an essential adjustment, you can pay it. So as I said in the beginning, it's $50 if you want to have 1 or 2 joints assessed, and $100 if you want to do 3 or more joints. And that's for the x-rays, the collaboration with Cheryl and I, and then the consult with me to go over your recommendations for what you would need for the stem cell therapy itself. Now, at that time, so you pay, you have the x-rays done on the spot. If you're somebody who's not in pain but wants to be assessed, well, then we recommend you wait until the stay-at-home order is completed, and then you can be assessed at that time. So you can be assessed immediately if you are having pain or discomfort. And especially for those that, possibly, like, we're in line for an elective surgery, which is currently canceled, you have that option because, again, lower side effect rate, lower risk for this type of procedure than a surgery itself. And that's when we'll really talk about at that consult if that therapy is right for you. Any other things to add there, Cheryl?
Nope. I agree. Yep.
Okay. So, from a cost comparison perspective, I think when you think about this, I'll openly tell you, so insurance does not cover stem cell injections. We will go over costs in your appointment where you do the consult after you've had the x-ray, should you want to move forward with it. But when you even just consider, when somebody has surgery, like you can see on that screen, that's a knee surgery right there where everything's getting cut open. There's obviously a significant amount of downtime, so potentially lost revenue from work, costs of having physical therapy or treatment after, follow-up. But just whatever your insurance out-of-pocket is, for many people, it's actually the same or lower to have stem cell treatment than it would be to pay the out-of-pocket from a surgical cost itself. As it says in the verses there, and I'm just reading this, it's typically a roughly 30-minute treatment. We do have follow-up appointments. You're consistently on the phone. You have access to Cheryl for as far as follow-up. She typically follows up at 1 week, 1 month, and 3 months. If we've had a couple people who just want to have their joint reassessed. I've done that on the spot because they wanted to see how it was tracking or how it was healing. And it really has a low amount of downtime. So you're able to heal just so much faster. And I think for most people, those costs aren't always factored in, but it is an important thing to, factor or assess. It's also why we keep that initial appointment so cost effective, because, if you're really serious about this, in my opinion, $50 to have joints assessed or $100 to have joints assessed, really that's a low cost barrier to be able to come in and have professionals look and see if it's something that's a possibility or a potential for you. I know a lot of places that are charging a whole lot more than that. As far as success stories, if we're doing this in the clinic like we traditionally do, we're able to answer questions right on the spot. We also have several people who have volunteered, and I say that strongly, volunteered to come give their testimony. They wanted people to know how well they're doing and how thankful they are that they've done this. So what I've done in this situation is, if you would like to talk to someone who's had this done, that's had good success with it, I've gotten permission to share their contact information and for you to call them. So as you're following through this process, if you'd really like to talk to somebody else who's had it done, you will have that potential. But I didn't think it was the right time to put them on, on a screen tonight. I want that way they can have it more personalized and individualized for you. So that completes our program. We are right on track. I said it'd be 40 minutes. We're at 39 and a half minutes. So I want to thank everybody that took time to be here. I want to thank Cheryl and True Health for their continued partnership and taking time to educate and empower people. Keep in mind, everybody, our goal is to empower you to have the best information to be able to heal yourself and have the best life possible. Have a blessed day.
Thank you.